I'm the policy director for the Government for the People campaign at the Texas Public Policy Foundation. It's our mission as a campaign to prevent government abuse. So as you can imagine, this is exactly up our alley. Now, as you may have guessed, based on our lineup and this list here, I have some good news and I have some bad news for you. So let's start with the latter. Unfortunately, the Texas House is having a rather contentious rules debate starting shortly, I believe at 10 a.m. And unfortunately, Representatives Murphy, Leach, and Patterson are unable to join us this morning. The good news, though, is that I found 3 movers and shakers in the policy realm. So these folks represent easily the brightest minds and the best advocates at the foundation. So I actually intend to learn quite a bit from what they have to say today. I'm very eager to engage. So very quickly, in the interest of time, because this year operates a little differently, we've shrunk our panel sessions down to 1 hour. So I've got to move a little quickly. So in the interest of time, let me quickly introduce each person. To my immediate right is the great Chance Weldon, who is not only one of our leading litigators, but also probably our deepest philosopher. So if you guys ever want to talk political philosophy, this is your gentleman right here. To his right is Shelby Sterling, my right hand at the foundation. She does all the hard stuff when it comes to local government issues. So thank you again for joining us, Shelby. And then to her right is the great Ellen Troxclaire, my friend and former Austin City Council member. She needs no introduction whatsoever. So with that, please help me give these folks a round of applause. All 3 learned last night that I needed them to jump on the grenade, and without any hesitation, all 3 said yes, yes, yes. So I am deeply in their debt. Thank you, thank you, thank you for everything. And so with that out of the way, let me do one bit of housekeeping for any of our legal minds in the room. Know that there is a sheet of paper on the back for your CLE sign up. Be sure to put your John Hancock on that. For those of you watching online who need the same, there is a QR code that I'm told you just scan your phone on, and you can sign up that way. So please be sure to do that. And actually, one last bit. For anybody who hears today's conversation and wants to know a little bit more about the Foundation's campaign, our Government for the People campaign, know that you can reach us at texaspolicy.com/GFP. Again, that's texaspolicy.com/GFP. With that out of the way, Shelby, let me ask you the first and hardest question. We look back over the last year and wow, there has just been a lot of stuff that happened. And most of it is premised on this section of code, chapter 418.
Yes.
And can you give the audience a feel for what is chapter 418 and how is it that we got in this spot with our state and local disaster declaration situation?
Yeah, absolutely. You're right. There has been a lot of stuff that's happened in the last year, and I can't believe it's been almost a year since all of this stuff has happened. So back in March of 2020, we started seeing that the pandemic was spreading throughout the United States, and it soon hit Texas, and very quickly we started having state emergency orders and then local emergency orders that were telling us to wash our hands and social distance, closing businesses, and we had shelter-in-place orders, and we spent a lot more time at home in 2020 than we ever expected. But the one thing that we did start actually noticing very quickly is that local governments were overreaching with their emergency orders compared to the state executive orders that we were told to follow. Made it very difficult to know which one you were supposed to follow. Were you supposed to follow the state, or were you supposed to follow your local government? And so some of those we did see were very overreaching and caused some abuse of their power. We had many examples, some which you can find at texaspolicy.com if you want to get a little bit more in depth with the issues. But the one thing we did start seeing is that we have places like Austin and Houston and Dallas, the big cities, that were enforcing more restrictive rules on their citizens and their residents, and once we started opening up, even the visitors. And it did make it very difficult once we started opening up, that we'd go from, Fort Worth to Austin, but you don't know exactly what order you're supposed to follow. And the thing is with this, and I do think that Chapter 418 is what everybody relied on. The state and local level, both the governments have relied on Government Code Chapter 418. But there's only a small section of the entire code of 418 that deals specifically with local governments, and that's 418.108. And within that, half of it with the original intent to deal with hurricanes, following a lot of deadly and devastating hurricanes in 2004 and 2005, they decided to reform a little bit of the emergency power, and with local governments in particular, clarify that they had some evacuation power, control the ingress and egress and movement of the citizens within the disaster area. And the intent of that was just to make sure that residents were able to get out on time before a hurricane hit. And unfortunately, with the way 2020 has unfolded and the way 418 has been interpreted, that also included with the pandemic, in the broader sense of being able to control how people were moving or not moving in 2020. And so we did see that interpretation very broadly, and in our view, it is an abuse of the interpretation of that, given the original intent was to protect people from hurricanes. So it's a very drastic, different view of what 418 was originally intended to do. And I think we're going to see, hopefully, a lot of reform, and we need a lot of reform, both at the state, but mostly at the local level of 418, so that such abuses like this, pending anything ever, another emergency happening, that we never see these kind of abuses again.
And so I'm not a lawyer, and nor do I play one on TV, but it seems to me when you read 418.108G, dealing with ingress and egress, there seems to be a rather broad interpretation at play with that particular provision. Am I misreading that?
No, I don't think so. And it has been a very broad interpretation of that specifically, although a lot of the local executive orders throughout the state just broadly cited 418.108 and said we can do all of these list of things, controlling people not being able to go to their houses of worship, or when they can go to the store, which store they can even go to, whether it be grocery or a small clothing boutique. They were able to tell you which ones you could and could not go to. And they didn't specifically, most of the time, did not specifically cite 418.108G in particular for the controlled ingress, egress of and movement of the individuals within these disaster areas. But that, again, is not the interpretation or the intent of what it originally was meant for. In 2005, Governor Perry directed the Office of Homeland Security to look at the emergency preparedness for hurricanes. And yet now we're seeing them use this and interpret it as such so they can control people from leaving their houses.
Chance, let me rope you in here, because you and Rob Henneke authored, I thought, one of the best articles of last year, where you elevated a Texas Supreme Court concurring opinion, basically said there is no pandemic exception to the Constitution. Can you catch everybody up on what that article was about and what the opinion was about?
Yeah, so one of the things that we saw with the courts originally, whenever all of these lockdown orders began, was a tendency for the courts, relying on an old Supreme Court, United States Supreme Court opinion, Jacobson versus Massachusetts. A lot of these courts were saying, look, we're not going to interfere with states or local governments when it comes to public health measures. We're going to defer to the extent that we can on these issues. And it may mean you don't get to go to church. It may mean that you don't get to open your business, but we're not going to get involved. We're not going to usurp the local legislative function or the local executive function. Now, to a certain extent, when you're 2 or 3 weeks into the pandemic, that's understandable, but wrong, but understandable. But what we saw starting several months ago, where courts stopped doing that, they finally started to reassert their role. And the concurring opinion in the In re Lamond case, which we talk about in that article, was the first time that the Texas Supreme Court signaled that that was going to happen. And what they said is, look, the Texas Constitution, the United States Constitution don't have a pandemic exception built in. And it's important to remember that at the time those constitutions were drafted, certainly the founding fathers of the United States and the founding fathers of Texas were aware of pandemics. They had a lot more of them back then than we do now. And yet, they didn't see necessary to place a pandemic exception to these limitations on government power. And so what we've seen since that time is courts have begun to reassert their role in addressing these sort of structural constitutional limitations on government power. And I think that's a good thing. And we give one example in the article, and it's one of my favorite cases ever, is a case called Ex Parte Milligan. And Ex Parte Milligan was decided shortly after the American Civil War. And it dealt with suspension of certain procedural protections, constitutional protections, in a time of war, in the war zone. So there's no crisis that we can imagine in this country more than the American Civil War. You had thousands upon thousands of Americans dead on American soil. And what the government argued in that case is because of this crisis, we can fiddle with some, at the margins, with some of the constitutional protections and some of the due process protections that exist. And that was rebuked by the United States Supreme Court in Ex Parte Milligan. And it said that the Constitution applies in all times, in all places, regardless of exigency. And so if the Constitution applies in all times, in all places, during the American Civil War, it certainly applies during a COVID-19 pandemic. And what we've seen is the courts more and more are starting to reassert their constitutional role and rolling back some of these restrictions, and I hope that continues.
Is that something you see happening more frequently?
Yes, we see this actually. You can see it even with the United States Supreme Court. Some of the original cases that they decided not to take, for example, the famous one was in Las Vegas. They were able to open up casinos, but they weren't opening churches. And the United States Supreme Court punted on that. They elected not to take that case. But more recently, whenever Cuomo decided to lock down, make similar lockdowns in New York, the United States Supreme Court struck that one down. And they reversed course on that, and they said whatever deference was due at the beginning of the pandemic is not due now, whenever we have a chance to look at these things more fully. And there's a great quote from Justice Gorsuch, who wrote a concurrence in that opinion, and he noted that even if the Constitution may have gone on vacation at the beginning of the pandemic, it can't go on sabbatical, right? And so I think that's important.
That's good. Ellen, as our resident practitioner, what I want to ask you is, will we ever get back to normal? But I'll save that for later. Instead, what I'll ask is there room for more transparency in this process? And what I mean is that it seems like a lot of these cities and counties, particularly of the larger type, are issuing dictates based on data that they're keeping behind the scenes and not necessarily revealing to the public. Am I imagining that?
No, that's exactly right. And you know, from a practical perspective, of course, we've heard the legal arguments against this overreach of power. But from a practical perspective, I think at the beginning of the pandemic, we were all willing to do the right thing. I mean, 2 weeks to flatten the curve. Okay, we're in this together. We can make sure our hospitals aren't overrun. Let's do this. And, you know, it's what, 9, 10 months later, and we're still seeing a continuation of those powers, even though we have more and more data that kind of disproves the efficiency and the effectiveness of these lockdowns. So, you know, from a public trust perspective, at least from the city of Austin, I think that it's a little bit of the boy who cried wolf, right? You keep hearing the same thing over and over and over again. Oh, it's just 2 weeks, or hospitals are going to be overwhelmed in just 2 weeks. And yet there is a reluctance, or actually a refusal on the city's part to really back up their mandates with any kind of data. We know that this virus affects people in different categories very differently, right? We know that the risk level is much higher for those 65 and older with or people with comorbidities. For young children in school or for young healthy adults, the risk is significantly less, and yet we still have not responded in our public policy mandates accepting that fact. And again, at the beginning, when we didn't have a lot of data, when we didn't know how the virus was moving, there was a little bit of panic, and I can understand them trying to do the right thing and maybe accidentally overreaching in that capacity. But the thing is, we have so much more information now, and we're not seeing public policy mandates respond in a way that's really responsive to that data. And then, the lack of trust as well was completely undermined or completely proven when we had the mayor of Austin, Mayor Adler, doing a Facebook Live video telling people that you have to stay home while he was on vacation in Cabo. So it's this idea of rules for you, but not for me. And so if it really is true, what you're telling us, if you really want us to trust you, then why are you in Cabo? And why? And I actually had no problem with him doing that. It was just that he was doing it while kind of turning around and telling the rest of us that we need to stay home, and a complete refusal to acknowledge the unintended consequences, but now very real intended consequences of a lockdown, the mental health issues, the depression, the suicide, the alcoholism, the lack of effective school for kids, especially for working parents who don't have the capacity to homeschool. I mean, there's just all of these other factors that, again, we were willing to do the right thing for a couple of weeks, but the fact that this has lasted so long kind of tells me that not only is it not based on data, but that they've gotten used to having the power, and that they don't intend to give it up anytime soon.
Now, Ellen, in the mayor's defense, he had just undergone a rather stressful event holding his daughter's wedding in downtown Austin, and he needed a break. So,
Exactly.
whole different set of COVID rules there. Shelby,
Right.
let's dig into some other specific examples, because it's not just the Austin mayor who's been behaving badly, or at least questionably, right? You've done an excellent job kind of documenting where it is that this local government overreach exists in the greatest fashion. Can you tell us what you found?
Yeah, absolutely. It actually amazed me how many examples we did start documenting when this pandemic began. And like Ellen said, like at the beginning, it was understandable. We were trying to do the right thing with flattening the curve. But as time went on, these examples were still there, or they were being newly implemented, months after the pandemic even began. The first one I know that we took a deep dive into was Tarrant County, excuse me. And Tarrant County's executive order in early last year alleged that the county judge had the authority to commandeer your private property. And while there is eminent domain outside in general law, outside a pandemic, or even within a pandemic, where that may be true, it was not true in this instance. And I know that the AG offered an opinion related to that as well, but alleging to commandeer your property because of a pandemic, I mean, like he said, there is no pandemic exception to the Constitution. My private property is my private property, and for a county judge to tell me because of COVID-19 you can come and take my house or come and take my property, that shouldn't be happening. And I was really happy to take a deep dive into that one, but it wasn't the only one that we did see. I mean, we saw that they were trying, again, to close churches and houses of worship. They were trying to impose excessive fines and criminal penalties on people that were deciding not to follow these executive orders, which at some points did not make any sense. 3 people throughout the state of Texas, 2 women in Laredo and 1 woman in Dallas, all had excessive fines and/or jail punishment related to the fact that they were offering beauty services during the pandemic, trying to make a living, trying to pay their bills, trying to keep food on the table. And these things, operating their beauty services, they're not criminal acts in general, so why should they be criminal acts during a pandemic? And so I know that those are definitely some of the biggest instances that we did see. We also saw Travis County and Harris County say that they wanted to do indefinite extensions of their executive orders. What exactly does that mean? According to Government Code Chapter 418, a local government can issue their executive or emergency order for no more than 7 days without their presiding body, their city council, saying yes. So if they want to do it for 30 days, their city council has to say yes to that. But the thing is, compared with the state, which has to renew it every 30 days, the local level, they only have to say yes once, as long as it's for more than 7 days. If they say it's more than 7 days, that's great, but there is no limitation on that. And that is one of the reforms I hope that we can work on going forward, because having that 7-day period, that is a lot to do it every 7 days. But with something like a pandemic, at least needs to have a limitation, if nothing less than what the state has to do with 30 days, is reevaluate every 30 days. But don't say that you don't have to reevaluate for an entire year or 6 months until the situation is different.
And so, Chance, how does that comport? Because on the one hand, you're telling me the courts say there is no pandemic exception to the Constitution. On the other hand, Shelby is telling me, hey, we're going to put all of these restrictions in place indefinitely. Mm-hmm. Is there just not a lot of case law in this area?
There's really not. And it's funny because I don't think that anyone should be shocked that governments break the law. You know, it's like, well, you said that's unconstitutional, but here they're doing it. Well, yeah, because governments break the law all the time. And you know, Ellen talked a minute ago about they don't base decisions on data. That's also shocking. And they don't follow their own rules. Surprise. But that's what local governments do. That's what all governments do. If men were angels, no government would be necessary, but they're not. And so, you know, one of the things that I always ask our interns, you know, I teach a class on federalism to all of our interns. And one of the things that I hope they take away from that, as I said, when you look at any policy question, you have to say first, can any government do this, right? Is this something that I could force my neighbors to do myself in sort of a state of nature, right? Because that's what government is. That's what all laws are. They're the threat of force. Is this something I could use force to ask my neighbors to do? Second, if so, which government? State, federal, local, right? Mm-hmm. Which constitution am I acting under? And then finally, you know, the next thing, you know, within that government, which branch? Should it be the legislature? Should it be the executive? Where is this power vested? And those questions may sound technical, but they matter because the legitimacy of government action is derived from the Constitution because we delegated that authority. That's the contract that we have. And so what you have here in the pandemic with all of these things is you have all of these things being violated. Mm. You have governments passing orders that no person, you or I, could not force our neighbors to do at gunpoint. You know, they're asking people to surrender their fundamental rights to meet together and worship, to go to your father's funeral, you know. Meanwhile, as they mentioned, you know, government officials are going on vacation to Cabo, you know. and second, the wrong governments are doing it. Right? You have things that should be handled by the state or should be handled by local governments that are being handled by the wrong governments. And then finally, there's no respect for the separation of powers. The Texas Constitution has an explicit provision that mandates the separation of power. Whenever you're talking about legislative rules, like for example, you know, lockdowns, those are legislative functions. Typically, if someone's liberty is going to be restricted, that is something that people have to vote on. And even if they do vote on it, there are things that sometimes you can't regulate even if people do vote on it. But instead we have executive orders, we have local magistrates making these judgments, we have local county judges making these decisions, and they're indefinite. An emergency that lasts forever is not an emergency, right? It becomes the new normal. And there's a real problem. You know, there's, you know, Cass Sustain and others on the left have said forever, don't let a good crisis go to waste. And what we've seen historically is that powers grabbed during an emergency are not given back when the emergency is over. And that's why it's essential that courts moving forward, to get to your question in this very roundabout way, and I apologize, is courts have an absolute duty to put their foot down. Mm-hmm. But the problem that people need to realize is courts can't rule unless there's a case, right? And it takes a lot of courage to sue the government. It takes a lot of courage and a lot of times, and oftentimes, a lot of resources to sue the government, and these things take time. So we need our legislators to stand up and push back because they're going to get things done a lot faster than the courts will.
And I want to bank off something that you said, a question for the group. you put forward the notion that a lot of these decisions ought to be provided for by the legislature, but instead they're going through either executive order, local magistrate, but in some cases they're actually being handed off to unelected bureaucrats.
Yeah.
And I think this is probably one of the more troubling aspects of this crisis, is that you have a city like Austin that basically hands over decision-making power to some public health entity that has no accountability to the public. Why is that a thing?
I mean, I can opine on that first. I mean, I think those things violate what's known as the Non-Delegation Doctrine. And what the Non-Delegation Doctrine says, is an old doctrine, is that things that are given by the people to the legislature, whenever the Constitution gave the legislature certain powers, that's a contract. And therefore, the legislature can't give those powers away to an administrative agency that has no democratic accountability. Yet we've seen it at the federal level a ton, starting in the 1930s, that that's exactly what was going on. And now we're seeing it at the state level with pandemics. And there's reasons that they do that, right? Because it's a lot easier to pass something off to some administrative agency and say, well, we're just going to trust the science. Because then if the administrative agency does something awful, which they often do, the legislator can say, don't look at me. I didn't violate your rights. That was just the agency. I'm just trusting the science. So it's incumbent on the legislators, to call that power back and say that we have a contract with the people and it's our job to legislate, not some bureaucrat who is making these decisions without any democratic accountability. And if the legislature is not willing to do it, it's the role of the courts to step in and say those delegations are unconstitutional.
Ellen, does it surprise you that the Austin City Council has kind of deferred a lot of the decision making to some unelected bureaucracy?
Yeah, absolutely not. It doesn't surprise me, but it does concern me that an interim public health official has all of a sudden, who by the way has never handled any kind of pandemic like this before, has all of a sudden become a kingmaker and has unilateral ability to put rules in place, and the mayor has empowered him to do that. But going back to this idea of the lack of data and the indefinite nature of some of these measures, I knew right away that it was all I don't want to say a farce, but that these levels, the city of Austin came up, and many other cities as well, came up with these, level 1, level 2, level 3, level 4, level 5 to help us navigate what we were allowed and not allowed to do, right? Like at level 3, it's kind of under control. Level 4, it's getting worse. Level 5, don't travel, don't go outside your house, that kind of thing. But did you notice that none of those levels were ever tied to any metrics? It is completely subjective when they go from level to level. For example, when the mayor returned from his trip to Cabo, all of a sudden we were at level 5, not a day before, right? Just when he returned. So it's not well, level 3 is when we have this percentage of hospital capacity. Level 4 is when we have this percentage of people testing positive for COVID, and that triggers movement between the levels, whether or not they're actually enforceable or not. So that is one indication. When you have when you have government mandates with absolutely no tie to scientific data that moves you between the levels, I think that is clearly just put in place to manipulate power. And then another time that we saw this kind of struggle between what is the right jurisdiction for us to handle this? What is it, local? Is it state? Is it and to Chance's point that it has to be litigated in the courts, we saw Austin try to make a power play when over New Year's Eve, when they came out with this mandate that I think that they clearly knew was unenforceable from the beginning, that restaurants had to close for 4 days, between 10 p.m. and I think 7 a.m. What data did they have to support that? In fact, we know for a fact, their studies have shown that COVID is not spreading because people are going out to eat, right? I think it's less than 3% of COVID cases through contact tracing have been found to be caused from people going out to eat or at restaurants. It's of course people who, and so their mandate to close their restaurants are pushing people back into their homes where the virus is spreading. And yet they did. I mean, the state had to step up and challenge it. These poor restaurant owners who have been through the ringer this entire year, they've been hit so hard already. They have spent tens of thousands of dollars trying to make their restaurant safe, putting up plexiglass, buying PPE, retraining their waiters, limiting capacity to 50% or less, social distancing. I mean, they have done everything that has been asked of them. And yet, with less than 48 hours notice and no data to back it up, the city of Austin tried to close them down. So it's those kinds of decisions that I hope that people are really waking up to the fact that this is truly out of control. You see, HEB, there were never any restrictions on HEB or on Costco or on all of these other places where we're around each other. And yet, why is a restaurant any less safe than an HEB? So there's a lot of mismanaged. I really think just trying to hide from the data. They know that the data wouldn't support the decisions that they're making, which is number one, why they push those decisions off to an unelected official, and number two, why they can kind of get away with it.
So Ellen, to that point, are they pushing the envelope because they are in pursuit of a particular agenda, or is it just by their very nature, that's what they're inclined to do?
I think it's both. I do think that we've clearly kind of shown over the past few months that there's, depending on kind of where you fall on the political spectrum, you have a different perspective through which you view the virus. I think that some of our policymakers really are trying to make decisions to the best of their ability, even though they've convinced themselves that it is their responsibility to keep people safe, and whether or not their idea of what that is to keep people safe is obviously up for debate. But I do think that they revel in the opportunity to kind of poke the state whenever possible. The cities tend to be very liberal, and the state is controlled by more conservatives, and so I do think that they take every opportunity that they can to challenge the powers of the state. And I think some of them have convinced themselves, which is the scarier thing, actually, that they've convinced themselves that they are doing the right thing. And the other thing that makes this argument so difficult is that for them, it's a win-win, right? These are all political creatures. The elected officials are they know that this is going to be something that they have to answer for when they go for re-election. And it's a win-win situation for them to say, stay home or else, right? Because if everybody if we don't see any change in the numbers, they get to claim that it's because of their mandate to stay home, right? And if we do see any increase in the numbers, it's because people aren't abiding by their mandate and we're not doing enough and we have to do more. So there is no, and if the numbers decrease, they say, yay, we did it. We flattened the curve for this week, but watch out for next week. You have to stay home. So they are hesitant to take any kind of bold leadership that would call into question their decision-making abilities when they come up for re-election next time. And so I think that's part of it as well.
Perhaps one of my greatest frustrations over the last 10 to 12 months has been some of the subjective determination being made, with either hidden data or no data, but also in the realm of essential and non-essential jobs. For the life of me, I can't tell you whose job is essential and non-essential. In my view, they're all essential. Any thoughts on that? Anyone want to opine? Or maybe it's just my own personal frustration.
I mean, I think this goes back to the first question that I mentioned earlier that we always ask the interns is before you even ask whether or not it's good policy or anything, you have to ask, does any government have the moral authority to make that decision? And I do not think that anyone has a right to vote on whether or not you earning a living to feed your family is essential. They just don't, right? That is a decision that each person needs to make for themselves, and a legislature, a city council, some room full of bureaucrats, right, looking at secret data cannot determine what an essential worker is and what an essential worker isn't, because to the person who's feeding his or her family, every job is essential, right? Every single one. And so I think that to treat people like they're cogs in a machine and they can decide who matters and who doesn't, that's disgusting, honestly.
Well said. I've got one more question, and then we're going to transition to audience Q&A, so get your questions ready. But an open-ended one that I think each person can come at from their own perspective if you want. But it seems like we have local governments doing a lot of things they shouldn't. And of course, Austin comes to mind, but a lot of these entities are guilty as well. What would you advise the average business owner to do in this kind of environment? Is it to seek out legal assistance? Is it to be vocal at the legislature? Is it to get engaged at city council? What should the average business person be doing right now, aside from navigating the myriad of crazy rules that we have coming at us?
Yeah, so I think definitely getting in contact with your legislator is always a good idea. That is your voice at the state level, which that literally has the biggest say over what we've been able to do over the last 10 to 12 months, aside from your local officials, which I also think you should get in touch with. And that's one thing that has also been an issue during the last 10 to 12 months, is making sure that you could either get in contact with your local official or have your voice heard during a city council meeting. Getting in contact and having your voice heard like you should in any regular day, any regular city council meeting where you are allowed to speak your mind and tell them how it's affecting you, what they want to do and how it will affect you, and why they shouldn't do it or why they should. And I think basically either having your voice heard, no matter who you're speaking to, whether it is calling your legislator, calling your city council, showing up in person, which unfortunately hasn't even been an option, and just doing everything you can to make sure that your voice is heard, and showing that you are being affected, because that's one thing that you really didn't see a lot in the media. You saw that businesses were closed or what rules were being imposed. But you never really heard from the people that were stuck at home because they were stuck at home. A lot of people affected, a lot of jobs lost, a lot of businesses closed, and yet where are their stories? And I think, from our perspective, we're doing what we can as far as taking a deep dive into researching all the things that they've done, making sure that we can catalog those and make sure that they are said during the now 87th legislative session. And that is one thing that we're going to continue working on, is making sure that those businesses and those individuals in Texas are not affected in the future like they were in the last 10 to 12 months.
And by the way, Shelby, not to toot your horn, but Shelby's got at least a dozen different recommendations on how to attack this 418 problem that we see. So kudos and well done.
Thank you.
Anything else? Or all right. With that, I believe we have a microphone that's going to be floating around. Is that TV on? Yes, but there is and I see you guys in the overflow room there. So we'll come to this gentleman first, and fire away, folks. Make them.
Okay, thank you. We've been talking about how we need to get to the courts to help us protect our rights. One of the things that's been kind of concerning is we've had very, very few jury trials here in Texas over the last 10 months. And I'm curious, how in the world where's the authority coming for not being able to have jury trials? I mean, I could understand at the very beginning, we didn't know that much, but it's been 10 months now. What's the authority, and why does this keep going on with no jury trials? Because there's a lot of people not being held accountable because of that.
Chance, let me put you on the spot. Do you have any thoughts on that?
I think it's a problem. I think that you have a right to a trial by jury. I think that there are people right now, from anecdotally that I've heard, that have been waiting now for extended periods of time, being held without their right to a trial by jury. Again, it comes down to this point of there is no pandemic exception to the Constitution. Now, in fairness to courts, they have to protect jurors because you get called for jury service, And you have to protect people when they come into that court system. And the Texas courts, the rules set up by the Texas Supreme Court, look, these things move slowly, but I think they've done a really good job of making sure that litigation continues to go forward. They're working it out. I think I can't speak to the procedures in place for, as they move forward, having jury trials by Zoom. I know that we had a non-jury trial, a bench trial by Zoom. It was a new experience, introducing exhibits and things like that. I've argued in front of the Circuit Courts of Appeals via Zoom. It's different.
Texas Supreme Court.
Texas Supreme Court. We had an argument a couple of weeks back in front of the Texas Supreme Court looking at little boxes of judges. But I think that it's going to be, it's harder with a jury. But there is a constitutional right to a jury trial, and that's something that needs to be fixed and moving forward. And I hope that as we get better about technology where we can keep people safe and comfortable coming to jury service, I hope that that's something that we can fix, and it's something we need to fix as soon as possible.
Yes, sir. We got a mic coming right here. Then we'll go to the gentleman behind it.
I'm from Tarrant County. Glenn Whitley is our judge there. I'm also from Colleyville, which is, some of you may know, is kind of notorious for their refusal to comply with some of the mandates that have come down, specifically with regards to 418. What changes are being looked at in terms of the language that might put limits on what these elected officials can and cannot do and their enforcement policies?
Yeah, so Colleyville definitely is. I'm from Hirsch, so I'm right next door. And some of the things that we have been looking at, and we've been looking at some things very broadly. Some of our recommendations are broader to fix 418 as a whole, and to help fix some specific issues such as open meetings and things like that. When it comes to the local level and the local authority that's under Government Code 418.108, one of the things that we are looking at potentially is to limit it only to local disasters. And that goes back to the original intent of 418.108, subsections F through H, which is evacuation, control of the movement of people and things like that. And then one other thing that we have discussed is that if there's a state disaster, just like we have now with the pandemic, although at the beginning the state did defer to local because it was not widespread completely. And so one of the things that we are looking at, I know, is going to be if there's a state disaster, a statewide disaster that is declared, there shouldn't be a local disaster to supplement that state disaster. If it's for the same thing, there's no reason to have two different executive orders to be following if they're supposed to say the same thing. And I think that aims at one of the things that we've seen, one of the issues, is the fact that local officials have added in one or two lines into their executive order that are different from the state executive orders, which are just that little bit of overreaching sentence that gives them that new power that, like we have mentioned before, once you expand that power, once you grab a little bit more just by those one or two subsections that they want to add into their executive order, they're not going to want to give it back. And so I think those two are our biggest aims, is specific with local governments and refining that control, just so that we don't have this pandemic, the issues with this pandemic, like in the future.
And by the way, if anybody either in person or online wants to find a list of all of our suggestions and research, just go to texaspolicy.com and enter emergency powers into the search box. All of our stuff will come up. Let me get Terry Hall, and then I'll get you, sir, right after that. Terry, how are you?
I'm doing well. Okay, so I wanted to just go back to the non-essential and essential discussion real fast. Remember, Kim Strassel this morning was saying the one reform that she felt like we missed on the Trump administration in those 4 years was civil service reform. Mm-hmm. And so can't we turn this back around on government and the bloat of government and say, where did those terms come from in the beginning? It was because when we had government shutdowns, essential workers still had to report to work, but the non-essential workers were shut down, right? So I feel like we could use this as an opportunity to turn it back on big government and say, it's you guys who have non-essential workers. It's not us in the private sector. So stop trying to treat us the same way as you treat them. And so I just wondered if that's something we can do to kind of turn the argument on its head. as we have this discussion, both on the state level and the federal level, right? Because there's plenty of bloat in state government too.
Ellen, Shelby, you guys have any thoughts on that particular question? Are there any at all non-essential government employees that we could possibly?
Yeah, I mean, I think that that's an interesting, it's an approach that I hadn't thought about, but I think it's really interesting. And my experience, at least dealing with the city of Austin over the past year or so, is, you know, now when you call I was going through a renovation at my house, and so I was dealing with the permitting department, I was dealing with city staff, and I was trying to get a hold of people, and they're all still working remotely. So you call the offices and the voicemail just says, "I'm sorry, we're working remotely, you know, email us if you have a question." And so, and of course the email is not nearly as responsive. So it's crazy to me that the essential government employees have maintained their salaries. They haven't had to deal with, you know, really very widespread furloughs or pay cuts or layoffs, or, I mean, the city has made no adjustments to what they're spending on their staff. Meanwhile, private businesses, of course, are shuttering their doors, and their employees are going out of business, and their employees are losing their jobs, and they're being shamed publicly on social media if they do try to open. I mean, it's just, so I do think that there has been an even further deterioration of the level of service, which was kind of dismal to begin with on the city level. And I don't know, so I haven't thought through how to manage that, but I think that it's an interesting point that you bring up. And I hope that we can get people, at least city and county employees and municipal employees, back to their offices, because I'm not sure that we're getting the services that we're paying for while they're working from home.
Kenzie, can we go to this gentleman here in the black coat?
All right. My concern is political interference in the practice of medicine, and you know, other than elections, looking for what those practical things we can do for it. So I have my own direct primary care clinic, so I've been doing active COVID treatment early. But the county, Travis County, they're actually restricted. So the people who are most vulnerable, low-insured, uninsured, low income, are actually denied, just flat out denied COVID treatment unless they go to the hospital, which is just medically malpractice. So what are practical things we can do beyond elections?
Do you all have any thoughts on that question?
You know, our healthcare policy analyst was actually sitting right over there, and now he is no longer there. I was going to say that you should talk to David
Yes.
Balot. But I do think that's really troubling that you have interference with the doctor-patient relationship that way. That's certainly not something government should be involved in, but they are.
Let me take a small shot at this one, because one of the things we do as a research foundation is we gather data, and then we try to educate the public on that data, right? And so one of the things I always encourage my colleagues and interns to do is to submit Public Information Act requests relentlessly, right? We ought to always be gathering data and information from the government to figure out what they're doing and why. And it's been made a little bit more difficult during these COVID times, because some of these entities have actually closed their public information shops, which is a whole separate matter unto itself. Yeah. But for the information that you think would either help bolster or defeat a particular case, I would encourage you to submit PIAs to get that information, then disseminate it, or at least send it to us so that we can disseminate it. I'm happy to make public, you know, any bad behavior. So I think it's important to gather data and then give it to entities like us so that we can go out there and advocate for the right solutions. Yes, I see we have a young lady in our overflow room. Yes, ma'am.
Yes, I'm Patty Barrett, and I'm concerned about the fact that President-to-be Biden has said repeatedly that he wants federal mandates for mask mandates and things to finally take care of this illness. And what rights are we going to have as a state if he issues edicts that are stricter than what we have in our state?
Good question. Do our resident attorneys want to take a shot at that?
So we actually have some litigation that's ongoing right now about the Center for Disease Control's eviction moratorium that was passed allegedly because of COVID. And it's been extended now again, and that's pending right now in the Eastern District of Texas. And the name of the case is Turkel. And I would take a look at that and see how that plays out, because that's going to be a great test case for understanding how willing courts are going to be to rein in federal authorities whenever they try to respond to the pandemic. So that'll be a good test case going forward to see to the extent we can rein in some of this federal overreach when it comes to pandemic response.
Shelby, you've looked a little bit at the mask stuff. Is it just, and I won't ask you to go in depth, is it fair to say that the research is mixed?
Yes. I mean, I think that's been very evident since the beginning of the pandemic, no matter whether it's the mask mandate or the closures of businesses and the shelter-in-place orders. The virus, and I'm definitely no healthcare expert whatsoever, but from what I have read, the research I have looked into, the virus has either changed, it's evolved, people are learning things as we go, and they've been constantly learning more about the virus as it's gone on over the last 10 months. And so the recommendations were often mixed, whether it be wear a mask mandate or don't wear a mask. Like it did go back and forth quite a few times, and I think there's still contradictory evidence on whether how effective they actually are or what grade of mask you're wearing. I have a cloth one that I have, and there are some great ones out there, I think, from as far as what's comfortable for me. But then you have the ones that are only supposed to be for healthcare workers because they are more effective. So I don't know as far as what the research is going to show, which one you should be relying on and which one you shouldn't be. And that's what's making it much more difficult, I think, for people in the public to understand which one are they supposed to be following. Because you've got your local official or your state official telling you one thing, you have doctors telling you another. Sometimes they agree and sometimes they don't. But I think that's going to be one of those things that's going to be very interesting to see as we continue to learn more about the coronavirus as time goes on.
Well, I can tell you, as the father of a 10-year-old, a 6-year-old, and an 8-year-old, not only do I think masks are not helpful, they are probably harmful based on what I've seen done to those masks, and then they put them back on their face. So
I can tell you, trying to work out with a mask is not my favorite thing.
Can I jump in?
Of course, please, Ellen, please.
Well, I mean, I think at some point, hopefully, the powers under the 10th Amendment will allow states, especially states with Republican governors, to kind of fight back against any nationwide mandate. But at some point, it's going to be up to us as individuals to take back our ability to make decisions for our families. So, kudos to the restaurant owners who, when Austin tried to shut them down recently, they said, you know what, come find me if you want. Like, I'm going to stay open. My employees are depending on this money to pay their rent. On the mask thing, yeah, I'm not going to go to a store. I tried to go into a store the other day with my 2-year-old and 4-year-old, and they wouldn't let me in unless I put masks on both of them. Never mind, I don't need whatever thing that you're selling badly enough to subject my kids to that in a completely, unscientific basis. So at some point, I am tired. I mean, I'm like so tired of being treated like a child and not being able and having my own personal responsibility taken away from me. And I worry that is affecting how kind of our younger generation is thinking. They're just looking to the government to tell them whether it's okay or not okay to do things. And we look around us, we take risks every day. We take risks, when we get in our car, we take risks when we eat unhealthy food. Like there's a million things that we do in our lives that we take risks doing, and we do it or not do it based on our own level of risk tolerance and our own understanding of our family and our health and what's better for them, what's not good for them. So I think it's really a problem that is kind of slowly but surely being eroded. And at some point, like I've come so close so many times. I mean, I think I was berated in Starbucks the other day because I wasn't putting my mask on in between the sips of my coffee. And I mean, at some point, I'm like, if it's time for me to have a civil disobedience moment and get in an argument with the Starbucks barista about, what I can or can't be doing, like I'm willing to do that, because I'm getting to the point where we just can't put up with it anymore. So I don't know if that's a solution to the legal question, but if this continues much longer, we're going to have to take it upon ourselves to do what we think is best for our families, kind of regardless of what the federal or the local government is telling us.
Well said, Ellen. We've got time for just probably 2 more questions. Why don't we go to Jim right here, and then you in the back, sir.
I'm going to hold it for you, if that's all right.
If we're spending our time wondering and arguing about and debating mask policy, we've already lost the entire war. The question needs to be, do we need masks? Is there actually a pandemic now that requires attention? Back in the famous 1918-1919 pandemic, people were dying left and right and everywhere, and in elementary schools around the country, they were stacking up coffins ahead of time because they knew some of the children in their school were going to die. The one thing missing from this pandemic are sick people and people dying from actual COVID. And I'll put a question mark at the end of this somehow, but
What say you, panel?
We need to get back to the basic. Is there a reason to have these things?
No. I will put myself out there. No. Why don't we go? We've got one question there, and I see we have one gentleman in the overflow room. We'll get to him in just a second if we can make this quick.
I'm sorry, this is more comment. My name is Gil Robinson. I'm the president of the American Association of Physicians and Surgeons, Texas chapter. Masks do not work. There's plenty of scientific data for that. Before the pandemic hit, we had several studies with influenza. British Medical Journal 2015 study is very good. It shows actually a statistically significantly increased risk of use of cloth masks versus N95s and surgical masks. So we're all wearing these cloth masks. There's very little data about whether or not no mask versus mask, but we do know the virus is 100 microns, the N95 pore size is 300 microns. And that even if you do, there are studies where they do seals of silicone around a mannequin, you still have 20% penetration through the mask of the virus. This mask is not against the skin like that, so the penetration is much higher. So the masks are wishful thinking, they're the wrong question, and you're getting the wrong answer. We're wasting our time. I wear it because I want to go into the stores. And then with regards to the coronavirus, there's something called the Danish study, 500 patients without mask, 500 patients always with mask. Obviously, Denmark doesn't have a mask mandate because they couldn't do such a study. 6 weeks, no difference. No difference. So, and if you read, if you read the CDC recommendations very carefully, you will see that the words can and may are inserted in their recommendations.
Very good, sir. We've got time for one last question in the overflow room. Yes, sir.
CDC reports 0.009% of the population of the United States dies each year, okay? There's been no increase for 5-10 years, okay? So is pandemic defined anywhere?
Great question. Does anybody know if pandemic is defined in state law, federal law? No?
I haven't seen it.
Not that I'm aware of.
I think that's an excellent question. we'll have to end there, folks. Please help me thank this great panel who, again, did so on the fly at a last-minute request. Thank you guys so very much for being here, and thank you for your support.